to And Here's Modi. And we're on. Hi.
Hi.
How are you? Stephen,
Good.
We're here today. Welcome, everybody, to And Here's Modi. We are here today with a friend of mine for over, literally,
About 30 years.
30
Way over
years.
30 years, yeah.
30, wow.
Yeah.
Wow.
Wow.
Since we've been five.
Wow, yeah. Yes, we are both in our late 40s.
Yeah. Yeah.
Very late 40s. No, I'm just kidding. But I've known Stephen, but I met you when you were doing you were looking for your residency.
Yeah, I was in my fourth year doing it was in med school.
What's his name?
Stephen. Oh, yeah. Yeah.
Dr. Stephen.
I'm
Did you take from the
Dr.
top?
Stephen Radowitz.
Okay.
I'm going to spell it.
Start over.
Okay.
No. Just from that. What's your full name, please?
My full name is Stephen Radowitz.
What are you
Doctor,
making him do his
MD.
full name? Was he slating? Is he auditioning? Is he auditioning for a role?
Radowitz. Yeah.
I feel like if I was
Stephen
a
Radowitz,
MD.
Jewish.
Yeah.
It's just such a Jewish.
I mean, that name is.
When you're sitting somewhere and you see a doctor coming, you want to see Radowitz across the name tag,
Yeah.
MD.
I just like the doctor part. Like, I feel like if I was a doctor, like, I would just be leading with that always. Like,
Really?
everybody just call me. Yeah, that's like
If
went to medical
if
school.
I went to medical school, it would be across my forehead.
Right.
I am a doctor, and you might not be. But I've known Stephen. We met when he was in New York, looking to see if he was going to do his residency there. You ended up doing it in
I was doing a
Chicago.
fellowship. Yeah, I did my residency in Chicago, but I did a fourth-year fellowship at Mount Sinai.
At Mount
in
Sinai,
Gaston. Yeah.
right, and so we became friends right
90s.
away. We've been friends since then, and we've gone through a million things together, spiritual journeys. We were both at the Kabbalah Center for a while. We were both at friends and his children and everything. And he's a close friend. He now lives on Mars.
Yes,
You li-
basically.
you live
Hastings on Hudson.
Hastings on Hudson,
it's
which is north of nowhere. It's just north, and you never get there.
No.
But when he did live in the city, we used to do Shabbat dinners nonstop, and
Still do them. You can
still
come.
do them. I know we
Cody
could.
doesn't like to come that often
Hastings
now,
is
but
like
it's okay.
5 seconds from.
It's 5 seconds.
From
It's
you.
like a half hour.
From the Upper West Side.
Yeah.
No, it's
Yes,
not.
20
it
minutes.
is.
20-minute drive.
It's forever. Okay, you're right. You're right. We've been busy. We're not. But okay, so.
Don't go.
During the pandemic, this is in my head what's happening. Everybody pivoted, right?
Mm-hmm.
I began doing videos. I had these characters, and you, ketamine and psychedelics.
Psychedelics from nowhere.
And here's the gag, because Stephen was always the doctor. You know, he was your doctor friend. Hey, I need da-da-da-da. You could never score Xanax or Valium or anything off of Stephen. He was like, you should just meditate and that'll help you. And just don't worry about your headache. And if you can't sleep at night, just do a little meditation. You couldn't get an Ambien from him, nothing. Boom. Pandemic's over. He has a psychedelic. He's in a psychedelic clinic with ketamine treatments, and it's going great.
Going
right?
great. It's amazing.
It's
Changed my
insane.
life. You told me I would be here. You told me I would be in Hastings on Hudson 3 years ago, and now I'm in a ketamine clinic working as a psychedelic doctor. I'd say you're crazy.
What kind of a
But that's
doctor
like-
were you before?
So I'm an internist.
You're
I
an
do
intern.
primary care, internal medicine.
Okay.
The best. He was
Yeah,
the
it's just
the
like-
few moments I caught him when he had his private practice on he sat there and he listened. He was like a Norman Rockwell doctor. He was like an old school. He used to listen and he knew, and he's very smart. And he was a great internist, right?
Yeah, I'm an internist.
the best. And then you I don't know, you worked also with
Goldman Sachs.
Goldman
Yeah,
Sachs.
so I do the primary care program at Goldman Sachs.
Okay,
I
that
still
sounds
do
like
that.
a good gig.
Yeah, it's great. It's really interesting. Never thought I'd end up there either.
But
I've been there for 12 years.
That's not podcast worthy.
No, we're not allowed
The
to
fact
talk
that
about
he is one of the main doctors. Tell us about Neshama.
So
Neshama's
Nushama's, it's a clinic. We use IV ketamine infusions to treat mood disorders. So from depression, anxiety, PTSD, any type of mood disorder.
Okay.
Even, addiction. It's all connected. It's
also
There's
not
symptoms.
for people who are. I've been there and I use ketamine and
Right.
Baruch Hashem, thank God. I'm not clinically depressed or anything of that sort. I use it as not like every day, and there's weeks I don't, but I use it once in a while to have an amazing meditation session, and I use it once in a while when I go to listen to music at a party, at a that kind of and in very small doses. But when you go to his clinic, which I did go to, it's beautiful. There's a chair with a panic button.
No.
We don't like to call it a panic button.
I don't call it a panic button. What do you call the panic button? What's
the call button.
The call button. It's this red thing here.
It's not a panic.
It's not a panic button, but it's a panic button.
Yeah.
Okay? And so this beautiful chair, beautiful environment, lovely colors. It smells wonderful in there. There's a nurse and a guide.
Integration.
Yeah. And you get the IV and you get an intense amount of ketamine.
And don't forget the food after. We do have
there's cute little food and everything.
Nice.
Okay. Back up here.
Here she goes. No, she's not it's not an easy sell with her. You have to.
First of all, Nushama. That's the name of it.
It comes from the word Neshama, which is one of the levels of the soul. In mystical Judaism, there's 5 levels of the soul. It's the middle one. It's about balance. So we're trying to get people into a more balanced state.
Okay.
And so it comes from that, and then Nushaman, as in, shaman. Now we're talking. Shaman,
That's clever.
That
so
you get. Neshama doesn't sell, but something not Jewish
Neshama,
now she'll go for it.
Neshama.
That's it.
So Neshama and Nusham. So
it means voodoo. You ready for? Now look how happy she is now.
It's Jewish voodoo.
No. God forbid. God forbid.
How do we go from being like a regular New York City Jewish doctor at Goldman Sachs to opening like an Allen Ginsberg Beat Generation ketamine center and God knows what else.
Psychedelic wellness, we call it. Psychedelic wellness. Doesn't that sound nice?
Psychedelic wellness?
Yeah.
Cute.
Wellness center. It's nice.
Because this is like insane to like most, I mean, I don't know, traditional medicine. Yes.
Right. And why is an internist doing this? Why is it? Or I call myself a preventive medicine. This is preventive medicine. And I got into it maybe about three and a half years ago. One of my closest friends was having chronic headaches for years after the first son was born. And they tried everything, Botox, acupuncture, sinus surgery, multiple medications, nothing worked. Every day at a certain time, terrible headache, incapacitated. And it'll come in at the same time every day.
It's like taxes.
Yeah.
It's like every year at the same time and the quarterly. Oh, maybe ketamine can help my taxes.
Okay. It sounds.
I just don't care.
I didn't go to medical school, but it sounds like
horrible.
It sounds like a brain tumor.
Right. Well, God forbid. Are you Jewish?
Not
Jews love to go brain tumor.
I've seen her do everything on this podcast, but to come up with a diagnosis. Are you insane? Could you let the doctor see?
Strangely, brain tumors don't usually hurt. Strangely enough, but that's another. We won't get into that.
See,
diagnosing brain tumors.
I'm sorry. I have to apologize.
It's so Jewish to go straight to brain tumor.
It's awful. It's awful. Go ahead.
So away from the brain tumor to the headaches. And so we decided, someone told us about these journeys, these psychedelic journeys. So we went to this very nice place, illegal, and it was a group journey outside, beautiful. They used MDMA and psilocybin. I went with them. And we went on this amazing journey. And afterwards, in the journey, he was shown exactly where the trauma was coming from, where these headaches were coming from, almost shown to him in a very clear image. And afterwards, the headaches completely went away.
What
no
did he
medications.
Show to him? As in...
He was seeing, he had vision. So when you do like some of these psychedelics,
like an X-ray.
No,
it was just
if you do psychedelic work,
people are thinking doctor, MRI, CAT scan.
No.
It's not. It's in your journey. You see this.
It's almost like a dream-like vision. When you're doing it, you're wearing a mask. We do it properly. When the journey work I've done, you're lying on a mat. There's music. There's guides and all this thing. And so when you're wearing a mask and you take some of these things like MDMA and psilocybin, you can have very, very and ketamine.
Mask.
Just like an eye mask.
An eye mask.
You limit the outside
stimulation.
Not those masks. No.
So you're talking about they were doing psilocybin, or
well, they were doing psilocybin and MDMA, a form of MDMA, sassafras, which is like which is an MDMA or MDA type compound.
Okay, together.
And
at the same
together,
time.
sometimes they mix it. There's different ways of doing it.
Okay.
And during the journey, it's about a 5 or 6 hour journey. You're shown. Sometimes you're shown things, and he was shown exactly some trauma that he had as a child, and he saw it with more, I guess, objectivity and love. And
I'm
he let
gonna
it
go back to the he's shown.
Shown
What do you
with
mean?
a vim. He was
with a guide,
no, he
or
was
he was
he
on
was
his
shown.
own.
You're on
He
your
was-
own.
So he was shown by his soul.
By his soul.
All right, so it wasn't like
His
'cause when
Neshama.
you say he was
Yeah.
shown. I'm thinking the doctor came in and showed him on the
No,
X-ray.
no.
He was
You're
shown. He
in
saw
psychedelic.
more than
We
he-
use
it
this
wasn't
term. Maybe I
shown.
use it
He
too much,
saw.
but yeah,
he saw.
he saw.
Okay, he saw.
Yeah, but
Okay.
I like to use the word because you are shown by your soul
Right.
where these things are coming from.
Okay.
And it's similar in ketamine work. It's very similar.
I don't know if this is the correct way. Like, is he's tripping or that's not?
Yeah,
like,
I mean, you're tripping, but it's very controlled. You're not out talking to people. It's
yeah.
very controlled. You're wearing the eye mask, not a face mask. You're wearing, there's music, and you just go into a very deep inward experience.
5 to
and you
6
listen to yourself.
hours?
It's about
That's a
5
lot,
hours.
yeah.
It's about 5 hours.
That's like when you do
Yeah.
acid. When you do
acid is longer. Acid can go
longer.
up to 10 hours
Right.
or more.
I knew somebody in high school who ate way too much acid, and after that, he always thought that he was a box of orange juice.
With pulp or
I
without.
always thought maybe it was. I don't know.
Wait, thanks for sharing that with us.
Okay. Interesting.
I'm gonna describe so here's my
Yeah.
my journeys and so in your office it was intense. It was a big
ketamine's-
dose. It was only an hour journey, but it was obviously you get there, the setup, there's the journey, and then there's the
It's very
coming
controlled,
down.
right.
Very controlled,
Which I
very
can do.
nice. It's insane that afterwards you just walk off an elevator and you're on 53rd and Madison. You're going from completely connecting to your soul.
Yeah.
We're a body.
Yeah.
There's a soul inside. We always say that his soul, he's
100%.
such a sweet soul. Oh my God, your soul. When we do your prayers in Hebrew, Elokai Neshama Shatata Bi, the soul you gave me, but you don't. It's impossible to really connect to it until you do something like this. Right. So you're in his office in the chair with the panic with the help button
help
here.
Call button.
And
Call
you
button.
have like you're in there, and my hands are like this. And now, the other times I've done ketamine, I was standing.
Yeah, you're at a party.
I'm at a party, or I am at home.
Do not recommend
I'm
that
at home.
at all.
I'm at home.
Yeah.
I think with the right doses, it's very nice, and I've had amazing clarity.
very nice. Yes, yes.
I will say that. And you can do it at home too. But anyway, this is an amazing amount of
promote
dose,
that.
and you're sitting there, and there's music in your ear, and you're going, and you feel your soul come out of your body.
Okay.
100%. And at the height of the high,
Yeah, we don't like to use the word high.
I didn't think you would use the word high.
No, it's
at
just
the
an
height
experience.
of the
It's just-
experience.
It's openness.
Right.
Listening to yourself.
But there's definitely, in the beginning, you can still feel your body and you
Yeah.
can still feel what's happening. You feel the chair. And then when it's getting stronger, you're just the soul.
Right.
And the music is guiding you, and whatever thoughts are happening with you, it's happening. And they're wonderful. For me, they were wonderful. There's, I'm sure, times where they're not that wonderful because things are coming up that you weren't expecting, but you feel that the body doesn't exist.
Are you talking to somebody
No.
throughout
No.
this?
So
No.
the most important thing is it's an inward experience. The medicine's not the ketamine or the psilocybin or the LSD or any. The medicine is your soul. Okay. In the end, it's your soul.
Okay.
And all this stuff does is a dimmer switch. It's like putting a key into your ego, into
Yeah.
your mind, into this machine that this soul inhabits, and dims it for a moment. And allows you access to listen to your inner self, and that's the medicine.
So as I was
And we
saying,
don't do that.
So as I was saying, it was just my soul.
Yeah.
You didn't feel, and then when it was coming down a little bit, the ketamine was coming down a little. At one point, I remember there was a moment where I said, "Oh, you know what? I can't lift my arms now," which I didn't want to, but I just then I just said, "Never mind. Let me just keep going on my journey. Here's this one. Here's that one. Wow, look at him. Wow, he was a soul too.
Yeah.
Wow, he was, even though he was a most horrible person, he was a soul too, but just involved in his body. And then when it came out, I remember cracking my fingernails.
Yeah.
And for a moment I go, oh my God, my body. I forgot about my body.
Yeah.
And he goes, I have a body. And it was like, and the soul that's going through all of this, because when you're really going through, you're like, I'm never going to go back to my regular body. I'm staying here. I'm going to just stay here. What am I going back to any of that for? And oh my God, that's right. I have a body and I feel it. And it's okay. And then you leave and it reminds you you're a soul.
Right. It's a
that
recalibration.
This is all just a place where your soul's living.
Right. It's about recalibration.
Right.
The problem is in life, we get too caught up with the mind, the ego, the worries, and this machine, the worries. The brain is just here to protect us. It's like almost a machine to predict the future based on past events. It's we're operating with an operating system that was programmed when we were kids. So all the traumas and all the difficulties and all these limitations have been programmed over our life. But these things are past. They're not even valid anymore. But yet we're still living our life trying to predict the future based on old data.
Wow. Okay.
You know, and so this, and if you want to, and yet this is what the soul is listening to, you know, and it's not the case anymore. So what this stuff does, it's almost like a reset button, opens things up, gets you more in touch with our essence. You know, when we're kids, there's no depressed kids. When you come out of the stomach, for the first few years, there is no depression. Kids are happy. They think in psychedelic ways. They imagine in crazy things.
So but this is like a new thing, though. Like ketamine,
it's not new. It's been around.
No, but I mean, it's illegal, right? Like it's now,
legal.
It's a new thing that's because when I was growing up, this was like something people did in like nightclubs. It was
it's really started in the '60s. It's used as a very, very, very safe anesthetic agent that was approved in the '60s.
Okay.
And the reason it's so safe is it doesn't affect our breathing rate, so people breathe normally. Most anesthetics suppress the respiratory drive.
Okay.
It doesn't affect the cardiac function, so it raises blood pressure or something, but it doesn't lower blood pressure, which can be more concerning usually. It doesn't affect your ability to swallow fluids. So like in most anesthetics, it numbs the whole throat, so you can't swallow. So they have to intubate people because otherwise you'd choke on your fluids would go into the lungs. It doesn't do any of that. So you're almost completely able to function, you know, in a certain way, your body can function normally. It's one of the drugs actually in the Vietnam War, they used to give it to troops. They keep a vial of it on hand. So if someone was wounded in battle, they can either self-administer or administer to someone who was wounded, someone else who was wounded. And at least it's an analgesic, so it decreases pain. And it also decreases anxiety.
Right.
So it can get them to safety. They can able to get up and go.
Sounds amazing. Why aren't I doing this?
Oh.
But it was so safe because
when I go see my accountant.
Yeah, boom.
Oh.
But you know, they give this to kids in emergency rooms in higher doses per kilogram than we give to grown-ups.
I don't know if you...
which is so interesting.
They gave it to those kids that were in the tunnel. Remember a while back, they were where was it, in the Philippines?
In Thailand.
No, in Thailand.
In Thailand.
And one of them lives across the street. He came in as one of the main kids on that soccer team. We know him. He lives across the street from us.
That's insane.
Yeah, but he's sort of being fostered into a family.
Wow.
Just for context, a bunch of kids got stuck in a tunnel
during it. Yeah, they were a soccer team and they went in, and then the floods at night, as they were in there was a big rainstorm and they got stuck. They got flooded in there for
And they
days.
gave the kids ketamine so they can take them out without them having panic attacks and things of that sort.
They were in there for like
forever. It was the hardest thing to watch on television.
Is it true that it was a horse tranquilizer too?
But you know, horses are more valuable than humans, so they wouldn't give a horse anything that was dangerous. But it's used in veterinary science because it's so safe.
It's the nicest little sidebar he ever threw
By
out.
the way,
horses are more valuable.
Well, they
than
are.
humans.
I mean, you know, these horses like they go for
It's
millions.
hysterical.
So I think the horse.
I remember. Look, I told you I never touched any type of drug or anything till I was late in my. Not late, because I'm not late in my 40s, but till I was in my 40s. Yeah. So I remember, you know, when all my friends would go out at night, he did K, he was in a K-hole. I was like, oh my God, it's a horse tranquilizer.
He was a little judgmental.
Very judgmental.
He was judgmental this
Really?
one.
Yeah, very
yeah.
I was doing comedy at night. I wasn't partying, you know, at wherever the clubs were. But so I heard it. He was in K, he was doing K, and I was like, oh, I'm judgy. And now I'm like, I love ketamine. And I'm saying, we don't need to agree on everything, but in your clinic clinic. What do you call it?
Yeah, health like a clinic. Yeah.
In your wellness clinic, in your psychedelic wellness clinic,
center.
and it is, they give cover, they give respect to the doctors
Yes.
that did the research early on in it.
Yeah.
All the rooms are named after them. It's really it's a sweet place to do it. Cheap, it's not.
No.
Okay, but it's a lovely place to do it, and people get amazing results from it. We have close friends who we can't mention because of laws, but change their lives.
Yeah.
But I also enjoy it on my own. Like there's nights that I'm alone in the house. I will take a little bit, put the music on, lay in my bed, and just go a little bit into my own world and think about think through some things, and really enjoy it.
And
They don't support
And I did
that.
it when I was younger, in my 30s, and I was in the clubs in New York.
Yeah.
It was very popular, and I hated it.
Really?
It's so ironic that
Why?
I'm giving this now. I thought it made everyone look ugly and drawn, and I just never liked the feeling of it in a setting. Everyone looked like skeletal, and I tried it.
But it
Yeah.
sounds
And I
like also
hated
you
it.
still are saying you
Hated it.
don't think that that's the setting in which
I don't
one
know.
should take it.
No,
like you're
I
saying
don't.
it shouldn't be
Not
done
for him.
recreationally.
No, I don't.
Okay.
It could be addictive.
Well, he is a
in
doctor.
Is it?
So the funny thing, in lower doses, it tends to be more euphoric, and it could be more addictive. It is addictive. It can be addictive in lower doses. In higher, more psychedelic doses, it's not like not necessarily a euphoric experience. It can be very difficult. It can be very challenging. It can be opening, but it's not addictive. And I don't think any psychedelic, when it's treated as a psychedelic in proper doses,
Right.
and that's higher doses, strangely enough, it has not been shown to be addictive in that setting.
Okay. I don't know. Listen, I'm not
not gonna
addictive.
get-
There's weeks and weeks and months
No,
I
of
go
course,
without
of
using
course.
it, and there's weeks, and then there's at times I enjoy using it.
There are some
I know
people,
if I go
yeah.
listen to some DJ or somewhere at Brooklyn Mirage or wherever, I might have a little bit of it, and super enjoy. And there's twice that I think I spoke about it on the podcast where we were dancing and the music was amazing. I was in my own world. I don't see the good thing about, for me, I think it affects everybody differently.
Right.
But for me,
does.
I don't see the people. When if I'm on a dance floor and I take a little bit, I'm in my own world.
Yeah.
It's me, the music, whoever I'm holding, and I'm in my own world, and I go through my own thoughts. And 2 Gemaras that I learned earlier in life.
What's a Gemara?
What's a Gemara?
Yeah.
The oral law, the Talmud. You learn things, and it became so clear to me.
Yeah.
It was on the dance floor.
Yeah.
What? Which ones?
One about the comedians, another one about real estate.
Inner wisdom, deep inner wisdom.
But like I understood them. I'm like, oh,
well, it's your soul.
whoa.
Gamora is your soul. Your soul knows
It's-
all this stuff.
The soul knows. No,
It knows
I
it.
will say, this is
Deep
going to
inside.
I think that the people who, it might be crazy. The guys, whoever wrote Kabbalah and the Gemaras, they were definitely.
they're doing
I'm not
something.
saying they were doing drugs, but they were on some kind of level that maybe they
you heard
had
of
aid
DMT?
to be there.
You ever
What?
hear of DMT? DMT is like one of the components of ayahuasca. It's a very psychedelic substance. They call it the God molecule. Forms of DMT.
What is it called? The who?
DMT. It's
God what?
It's like they used to call it the God molecule. It's
Oh.
5-MeO. There's different formulations of this compound, and it's actually made naturally in our body.
Yeah.
It's also found in acacia wood, which is interesting. The Mishkan, the Aron
wow.
is made out of
Acacia wood.
and it's actually, look it up. And I didn't believe this when I read it, but it is true that there's, in lower concentrations, but this compound, this psychedelic compound, is found in the wood, the acacia wood.
Okay.
So
And you do have a lot, and I just want to make sure your clinic has a lot of Hasidic people coming
yeah,
too now.
we have a lot of Hasidic people from very deep, from
this
different
is
communities.
so that was my question. Like this is like a pretty controversial or maybe not forward thinking alternative
future,
way
yeah.
to
I think it's an amazingly safe and more effective than I expected. My fear when I started this, I jumped into, I don't even know how I went into it because I thought it was the right thing to do. And because, people would come to me from different psychiatrists, and on multiple, they'd come back. I'd send them to a psychiatrist, and they'd come back on 5 different medications.
for what though?
dead.
Give an example.
Dead.
Like what's the quote unquote disease? I know you don't like
So
that.
yeah, I don't like, depression, anxiety, or, for the most part. For most people,
Yeah, careful.
I have to be careful here.
very careful.
I don't think people with depression, anxiety are diseased.
Okay.
Okay? I don't think they're diseased. I think they're symptoms. Like if someone breaks a bone, okay? God forbid. God forbid.
God forbid.
God, chas v'chometz.
God forbid.
Okay.
But there's a bone broken,
Okay.
and there's pain. Is the pain a disease? No, the pain's a disease. The pain's a messenger letting you know there's a bone out of alignment. Do something about it.
Okay.
But in this society, what we do is we say pain is a disease. Chronic, you have pain. You're pained. And we load them up with pain medications, morphine, and we say, continue walking on the leg. You don't feel the pain, right? But you're walking a little crooked, and eventually, because you're not taking care of the pain, you're not listening to the message. Eventually, you're going to need more and more of the morphine, and eventually, you're going to have to do something about it. Same thing with depression, anxiety. It's a psycho-spiritual misalignment. It's a misalignment between your ego, your mind, and your soul. We all know deep inside where we want to go, what's good for us. And when we start to move beyond that, how do we know? Our soul talks to us through our emotions, through our feelings. And these depression, anxiety are letting you know, hey, there's something out of alignment, but we don't listen. We don't listen, so we keep on. And notice in the beginning, it's a little bit of, it's subtle. We just get like, I know I'm not in the right place. We don't listen. We keep on going. I'm not with the right person. I keep on going. 10 years later, you get depressed. And then it's really depression. And then you're on medications. And then you just need a big Zets sometimes into the next life. But, God forbid. God forbid.
Now, hopefully before that Zets.
But that's the whole point. We have to listen. The point
out.
is to listen. But we don't listen. We numb people up with these antidepressants. I'm not saying that there's not a place for antidepressants, because there are. It's the same thing. Sometimes, you break, God forbid, break the leg. You need some morphine to get into the dog, get to the hospital, and you put a cast on it, and eventually the bone heals, and the pain's not necessary anymore, and you go and you start walking straight again without anything, and you're no longer diseased. The same thing with depression, anxiety. If you listen to yourself and you listen and you do it, but eventually the pain becomes the depression, the anxiety are symptoms that are no longer necessary.
So what have been a few people or examples that you've seen where you're like, wow, this is...
Yeah.
Give us two wows.
I'll give you a big, I had this Hasidic woman, a woman from a very, very religious community.
What's her name? I'm just
Stop.
kidding.
What's wrong?
I can't tell you so much.
Her name is...
Yeah. Beautiful, beautiful woman, actually, and really very sweet. Father's a rabbi. Really, really nice family. Very nice family. Anyways, and she came in. She couldn't even sit in the chair. Her husband was the nicest man I've ever seen in my life. She was so deeply depressed. She had incredible trauma. Trauma from post-Holocaust survivor and everything, abused mentally, sexually, everything. Okay, but a beautiful, beautiful person, and. The first time we gave her the first infusion, she was just a mess. She couldn't even sit still. She was jumping out of the chair. She just couldn't sit still.
Younger, older person?
Younger.
While she had it in...
She wouldn't let go. She wouldn't let go. She was taking off the mask, and she couldn't. She was so deeply disturbed. After the third one, something broke in her. She just got in touch. She felt her soul for the first time. And we escalate. We usually start off with a low dose. We see how people do it. Except with Modi, I went really high.
He went
I just
so...
loaded
Oh, my God.
Oh my God.
I'm like, he needs it all. I know him very well.
He knew I'm not coming back.
No. He's not coming back.
I'm not coming back.
No, we're not giving him any tester doses.
Sets him like three visits in one.
Yeah. But most people, we start off low, and then it's a process. You know? Anyways, but then she was an artist. She was very talented, very intelligent. And her artwork before she would make these beautiful paintings, very detailed, very more realistic paintings.
Mm-hmm. Yeah.
After the third one, she came in. She showed us a picture of this painting that was like literally can go into she says, this is the painting for my soul. That was for my ego. This is for my brain.
Wow.
And you saw this painting, and it was just unbelievable. I looked at it, and I'm like, this is coming from a Hasidic woman? Like, I couldn't believe what she was painting. It was very abstract, but it was just, you can tell a soul painted that painting. And if it went in, I bet you, if she went, she'd make a lot of money with this. And hopefully she does. Wow. Because but then she woke up, she wasn't being able to even take care of her children. She started becoming more present with her kids. Unbelievable. Like, walked out.
Wow.
And this doesn't always happen. I'm just showing you the good, that there's also difficult cases, but she really opened up. She felt her soul, and she came back to God. She stopped believing in God. The trauma she went through, you question, this whole thing, and it brought her back to
God makes a lot more sense.
That's why a lot of the very Hasidic
gone to this,
because God doesn't punish. We're not here to suffer. Number one. We're not here to be punished. God doesn't punish and God doesn't make us suffer. There's redirection. There's recalibration. When we go off path, we have to know we're off path. How do we know off path? But usually it's very subtle messages. But then sometimes, again, the zets at the end.
How many sessions?
We don't want to wait for the zets.
No.
And hopefully ketamine wakes you up and allows you, what it does is it allows you to listen to yourself. It turns this off for a little bit and go, oh. And you get to see, like he's talked about, you can see things in a more objective way. The people that hurt you, it's like it's just a mess. These people are just messengers.
Right.
It's about forgiveness for everything.
Yeah.
Everything. It's the only way to get rid of it. It's hard to forgive someone that abused you. It's very hard, and it's not. And it's a process I don't expect. But it's not releasing. It's not letting anyone off the. It's not justifying what was done to you. It's releasing yourself from it. And ketamine allows you to see it with more objectivity. And the universe and God will take care of them. It's none of our business to punish anyone. You know?
How many sessions?
So our protocol is a series of 2 infusions a week over a 3-week period.
Wow.
So it's 6 infusions and boosters if people need them.
Boosters.
Boosters.
It's like Botox, like a little touch.
We call them refreshers. Actually, we're changing the terminology.
And what's the difference? What's the difference between this and psilocybin? Because like I used to eat handfuls of mushrooms.
This wears off. If I can answer you from what I've done, I think when you take ketamine, you hit it. You hit it. I'm definitely a term you don't want to use.
God, yeah.
You take it. You enjoy your journey. You go through your journey, and it wears off, and you're done.
How do you take it? Are you smoking this?
But with
the psilocybin?
Psilocybin? No.
Ketamine's an IV infusion. So we put an IV in, and it's a nice smooth journey.
I have a
what
pill.
do you do?
I have either a pill or a spray, a nose spray that I use if I'm doing it on my own. Much lower doses than what you're doing at Neshama, but gives you that feel. The music is there. I'm on my bed. I'm thinking of people. Jokes come to me sometimes. Again. Always something Jewish comes, a prayer. I go, now I know why they say be'anachnu, not be'ata, and it's things like beautiful. That hit me. And then it wears off. I get up and I get a coffee or whatever, and I go about my day. I have a friend who has the nose spray. And again, I think everybody's on.
Where are we getting these nose sprays?
Not what this session's about.
I don't know anything about this.
It's not his thing at all.
About this.
But I have a friend who takes it before he goes jogging, and he's like he doesn't feel. And everybody your own. You have to. One thing I say, you have to find what works for you.
Yeah.
I'm
not judging anything. People.
Yep.
What we do is different, and I have a certain purpose as a doctor that we don't do it that way.
Right.
Although there is a nose spray Spravato, it was approved, a form of ketamine. It's a racemic. So sometimes the ketamine that we use is a combination of 2 almost like mirror images of a chemical.
Okay.
And Johnson & Johnson, what they did is they took one of these mirror images so they can prolong the effects of it, and they can get a patent on it.
Right.
Because the current ketamine is generic, so you can't patent it anymore. But they took one of it and they created a nasal spray that people can use in a treatment, and it has to be done in a controlled clinical setting, very tightly controlled.
Not the nasal spray. That's not what I use.
The nasal spray, each of those sprays costs around $500 to $800, and it's covered in certain insurance companies will cover it.
Not what I have.
But it's crazy. But it's not.
Johnson.
Not what I have.
But this is not what he's doing. He's doing racemic.
Again, you have to find what works for you.
Yeah.
And just because this one does that and that one does this doesn't mean you're going to go through the same with them. You know, if I don't have a show at night and I'm going to go work out, I take 2 hits of a joint, and the workout I have is it's literally mishamayim. It's from heaven. I feel all my muscles. I want to stretch. It's heaven. And then it's only from 2 small hits of a joint. That does not work for other people.
Right.
A lot of people go to the gym after you smoke a little bit. Oh my God! No.
We're using it to escape. We're not looking to escape. We want to actually confront. We want to see our problems. We're not looking to. This is not like you're going to do a ketamine or any of these psychedelics. They shouldn't be used, to get high. It's about enlightenment. It's about listening to yourself for the first time, and that's how it works. I mean, it really works in incredible ways. But you have to put the work in. And if you're not willing to put the work in, everyone says, "How long does this last?"
Right.
How long does it last? It lasts as long as you want it to last. As long as you have to put the work. This shows you what you need to do. It's up to you what you want to do.
I'm so happy I didn't discover any of this stuff when I was in my 20s or 30s. I would, because God knows where I'd be. When you're ready to change, and I went through a lot of spiritual journeys before I got to this.
You have a spiritual background, but if you don't have that, it could be used as a form of escape, and it could be dangerous. So I think we have to respect it. You know, ketamine is not, and any of these things, they have to be used responsibly. I believe in a medical setting, but I'm not going to judge anyone. But and when it's done with the proper, preparation and intention, it can be incredible experience, and it can be a very, very deep experience. And my point is to get people off of those, hopefully. And I don't tell people to stop, and they can actually go on ketamine. They can be on their antidepressants while they're doing the ketamine. But the point is to not need those anymore. They might not need the drink. We have people come in for mood disorders and they drink every so often, or they smoke cigarettes. And then afterwards, after they come in and say, I stopped smoking. I just didn't feel like it served me anymore. When you're in touch with your soul, you don't want to inhale this poisonous smoke into your lungs. It just doesn't seem to make sense.
Or
drink alcohol.
You have a different respect
I have
for your
nothing to
body.
do, or smoke weed every day. It just doesn't seem to make sense. What am I trying to hide? I could feel high just being alive.
Right.
When you're in touch with your soul, you're high. That's a high.
Yeah,
but it's also actually saving people's lives.
Yes.
I mean,
it's saving people. People come in acutely, and some of the other, people come in acutely suicidal, and they leave and they walk out and they say, look, well, suicide seems unnecessary. Why would I kill myself? I'm a beautiful soul. When the brain comes back online after the ketamine runs off, hopefully it's a better calibration. There's a better balance between the soul and the body. We need the ego in this world. We're not looking to kill the ego. Everyone talks about ego death. If we kill our ego, we're dead, and we can't survive in this world.
If you have a little, your ego does get you out of the house.
No, we need a little ego.
But you have to be controlled and to know that it's not the main.
Let the soul take control. The soul should be in the driver's seat, not the ego.
Yeah.
Use the soul.
That's
it.
good.
Someone said Gedalia Fenster. Everyone listen to Gedalia Fenster. I listened to his. He's you ever listen to him? He's amazing. Gedalia Fenster. He's does these Breslov talks. He's from Miami. He's amazing. But he said in one of his lectures, his talks.
Breslov?
Breslov, they're Breslov. He's cool.
Yeah.
He's not even a rabbi. He's very modern.
Breslov is a sect of Hasidic teaching, which is
very happy.
Yes, very happy.
They really try and promote the happiness from the Baal Shem Tov of it originally. Anyways, I'm not going to get into that, right?
We've gotten into that, but it's one of the Hasidic disciples of the Baal Shem Tov, and they have a very fully happy serving God with
joy and happiness.
Which is one of the craziest things, because the Hasidic movement, I've spoken about this, was made out of serving God with joy.
Yeah.
But if you go to a Hasidic community, no one looks happy. They all look
that's not who we are.
and miserable.
That's not who Jews are. And we get a lot of Jewish people from unreligious to the most ultra-Orthodox religious.
Yeah.
And there's so much trauma in our people. So much trauma. A shared trauma. Intergenerational, if you believe in the Gilgul, past lives. It's you can feel it. You can they all come in and they have the shared issues.
Do you believe in past lives?
I believe in past lives. 100%.
Are you crazy?
It's part Judaism believes in past lives. Yeah.
Yes.
It was taken out of a lot of our religion because some people thought people wouldn't take this life seriously. And you have to take this life seriously. You can't get too caught up with the past lives, because everything you need to learn and for your soul to learn is in this life. But a lot of the traits, so there's some of the things that we come into this world, that pain and the depression is accentuated from past experiences that were not processed. We're here to process. Within every issue, within every difficult experience, trauma you call it, is a jewel for us to learn, to grow. And get this from Gedalia Fenster, one of his lectures, he said, and it just sticks with me, and I use it all the time in my clinic. I tell everybody, is that our wisdom is a memory without the emotion. Think about that. And it's just I don't know why. It's such a simple wisdom.
Memory without the emotion.
Is a memory without the emotion. So a memory is a past situation,
right?
Okay, that hasn't been processed. Some past thing happened to you. You haven't forgiven it, accepted it, extracted that beauty out of it. Mm-hmm. And once you extract the beauty out of it, then it just becomes a beautiful memory. It becomes a building block in your foundation of who you are. And then you move it. Every successful person has gone through some shit. They've gone through things. They've gone through problems, but they don't sit there. They don't have these chains attaching to them. Once you process it, you accept it. It's from God. Everything's from God. I don't want to get to God, and their experience from God. And so, and God, and I go by one thing: God doesn't punish, and God doesn't put us here to suffer. So it must be there for something good, right? So once you accept that, find the good in it, accept it, and then move on. Right. It's not easy.
No,
I have my own things.
It's
We all have
very
to.
easy. We
It's
all
very,
have our-
it's very simple but hard. But that's part of the game here.
That's right.
You know, it's like what I also use, and I even tell non-Jews in.
I even tell
Even
non-Jews.
non-Jews.
I even tell
Even
non-Jews
because it's so Jew. But maror, the horseradish. You know
Right.
that root. You ever see the root?
Yes.
On
It's not-
Passover,
it's
we
not a
we
beautiful
eat this
thing.
very bitter herb.
Bitter herb, and it's like and the root is this big mongoloid ugly root.
Right.
It's just it's all our crap. It represents all our garbage from our past, and you cut it into these little things and you chew it. This is what I learned at the Kabbalah. You chew that in the Seder. We do this, and if you chew it, once you start chewing it, it's so bad, it's bitter. You're crying. You feel like you're going to die. The key is you have to keep on chewing, and if you keep on chewing, it turns sweet.
Mm-hmm.
It turns sweet. If you spit it out too early, the pain persists, and then you have to do it again. And I do it and if you do it with that consciousness, it's unbelievable. And you realize everything in life, everything turns sweet. You just can't run from it. If you keep it chewing, you have perseverance, you persevere, and you really push through it, everything will turn sweet.
Amen. Okay, let's start wrapping this up.
That's what it's about.
How do they get to see you? How do they get to have an experience at Neshama?
Yes.
What's your
Nushama. So we have a really
and it's
beautiful
spelled
center,
in a way
gorgeous,
you'd never know how to
beautiful.
spell it. How are you spelling it?
Nushama.
That's exactly how I
Nushama.com.
That's not how I would ever
No,
spell
Neshama.
Neshama.
Well, because we took it.
Neshama, but
And
this is
Nushaman.
Neshama, but this is Nushama.
I'm hearing Nushama.
Nushama.
Nushama is a
My mother
Shama.
Shana. Nushama. It's like my father,
It's over there.
Shana, come here.
Oh, you're so,
father,
Nushama.
you know my father.
Neshama, but it's spelled Nush.
Nushama.com.
.com.
And it's a beautiful place.
It's a beautiful place. I guess once they get there, the intake situation.
Yeah,
they'll
so
figure it out.
everyone goes through a medical intake. We make sure it's a safe option and a good option. So they meet with me or a nurse practitioner, and we go through their medical history, psychiatric history, all their medications.
Mm-hmm.
And if we feel it's an appropriate choice for them, then we book the appointments and we go and we come in for the appointments. So,
Very nice. Very
Amazing.
nice. And
Fascinating.
I'm at
Yeah.
modilive.com, and this is what I need, Leo. Okay.
And you have shows coming up.
Hashem.
But they're all sold out.
They're all sold out. It's so much fun. I'm in LA on the 16th to 17th, but at the Laugh Factory, those shows are sold out. The holidays shows. The 24th of December, 25th of December, and now we're adding another night because those are sold out, and overnight, boom, they sold out. So we're adding another show for the holidays. It'll be the Thursday before the Yontif, before Christmas. So it's what would be the Thursday there?
The
Horrible.
20 something.
Modilive.com, MODILIVE.com. And now we've also announced I'm in London in March. Those tickets are going to fly off the shelves. And ModiLive.com for everything. Stay in touch. Modi_live for Instagram.
Everything.
And you and I are going to be together. She's a comedian too. I don't know if you've known. She hasn't said one curse word here yet today. You were the one that
very
cursed.
clean. I'm the only one that
It was very,
cursed.
very
Yeah.
clean. But usually she drops all the bombs here. But you and I are going to be December 1st, 2nd, and 3rd at
Mohegan Sun.
but the place is called Comics Roadhouse.
Comics Roadhouse.
Comics Roadhouse, and that's going to be a fun show. If you guys are in the Connecticut area, make sure to get tickets for that.
Or
Thank
you can drive in, even if you're not from the Connecticut area.
Why not drive in? It's not a bad drive in. You can go lose some money at the casino and then come in. And thank you all very much for listening in. Thank you, Stephen, Dr. Radowitz.
Yeah.
And definitely, it's definitely worth an experience to go to Neshama.
Thank you.
Thank you all very much.
Thank you guys.
Bye.
Thank you.
Oh, we didn't ask him who his his rabbi is.
Okay, so
That's too
how-
long.
yeah.
He'll go forever.
Go.
No.
No, just
tell me.
ask.
Tell me. It's
How much
nice.
time are we at?
You got a little time, but if anything, I just want to grab this microphone. I just didn't want to
Yeah.
interrupt you guys.
Who my rabbi is?
We have a few minutes.
We
You want-
how much have we done already?
46 minutes.
Oh, so yeah, for sure. Okay, let's just do this then. You have to edit it back. How does it go?
Edit it back.
Just edit it out.
Yeah,
Okay,
like-
let's
Maybe
ask
we'll
him.
use it, maybe we won't. It's good to have.
It's
What?
good to have. Okay,
What, my rabbi?
so I'll set it up in a minute. Are we good to go?
Yep.
Okay, so we always ask everybody, who's your rabbi? and it's not like who your rabbi is in your synagogue, who would you turn to for spiritual guidance, be it your children, or maybe for your clinic, or your
Or medical
I have a
guidance.
couple. I have a few. I'd say one would be, I guess, Eitan Yardeni,
Okay.
Kabbalah Center. And I'd say Rabbi Benji Silverman. He's a Chabad rabbi in our neighborhood who I really love. He's amazing person. So I go to him. We go every week. I go every Shabbat. We listen to
Benji
Torah.
Silverman in
Benji
which
Silverman
Chabad?
he's in Dobbs Ferry in the river towns.
Wait, what about
And-
doctor rabbis? Like, what if you're like freaking out about some like crazy doctor medical thing and you can't
Who would you
figure
go
out
to? Yeah.
like some
If I need like a doctor that I can't figure something
like a doctor, like a second
I don't go to
opinion or
doctors.
no, but like if you have like a hard, no, but if you have like a really hard
You know
case,
they know nothing.
Yeah,
He knows.
one of my closest.
Dina always says
Dina.
doctors know nothing. He's
Yeah.
a doctor and says we know nothing. But
Great.
no, I'm thinking more if you have a patient that's going through your
Yeah.
treatments
Yeah.
and things aren't going where you thought they would go, who would you turn to?
That's right.
If who would I turn to for? I have a few people. It's a good question.
Okay, doesn't matter.
Leave it,
We
leave it.
got
Yeah,
it. We got it.
yeah,
Eitan
yeah,
Yardeni and Rabbi Silverman from the Chabad of
Dobbs Ferry.
Dobbs Ferry.
River Towns.
Dobbs
Yeah,
Ferry.
yeah,
Okay,
yeah.
great. Thanks again for coming on and edit that nicely.
Yeah,
Everybody, thank you
edit that
so much for
nicely.
being a part of And Here's Modi. Love you all. See you all
what is
soon
it?
at a live show.